Hello, everyone, and welcome to another Focus podcast. I am Singinlisa, your host. Glad to be with you once again. And of course, a very special edition for you here because this edition, we're going to be celebrating COVID heroes. That's what we want to call it. And we intend, even for this submission, to make it to the National Library of Congress. And so we're very honored to have Dr. Michael G. Russo. He is a family practice physician in Marrero, Louisiana. And so let me say welcome to you, Doctor, and so glad to be able to speak with you today.
Well, and it's a pleasure to be here. Glad to help out any way we can.
Absolutely. Well, you've been through some things that a lot of us don't have the words to describe, but you do. And so we're really honored to be able to have you here just to share your experience as a survivor from something that everyone has come to know as COVID-19, coronavirus, very familiar in our vocabulary these days. And so let me begin by saying, what was life like for you before COVID, took over in a sense?
Well, we have what I consider a successful medical practice over at West Jeff Hospital here in New Orleans, and we've gradually been expanding and getting bigger. And we do a wide variety of different things: geriatric medicine, nursing home medicine. We have an outpatient clinic. We do detox to people who have opiate addiction, and management of common disorders like diabetes, hypertension, coronary artery disease. So really a wide different array of different things. I mean, we have a sizable hospital practice. We also have a long-term practice. And things were going pretty good, until the COVID pandemic started, and everything kind of took a turn in the wrong direction, I guess, at that point,
What was your day-to-day activity? I know you've covered many areas, but where were you when you first learned about how serious this COVID-19 was going to be?
I guess at first it didn't seem like it was going to be as serious as it wound up turning out to be, because you hear about different diseases pretty frequently, but at first this was just another disease that started and kind of spread and started impacting the stock market. And then it started spreading through Europe, and I guess at that point it became only a matter of time before it hit the United States, and finally it hit here, and we were all talking about how we were going to handle it, and we were hoping it was just going to be a seasonal sort of problem, and eventually it moved here, moved into the nursing homes, and since we have a sizable nursing home practice, that was a big problem, and once again, I eventually wound up contracting the disease myself, and became pretty sick. I was out for at least 10 days, and
were you able to track when you first thought that it may have happened?
Yeah, at first, just cold-like symptoms, and really over the next 2 or 3 days, it got progressively worse, and then I knew there was something up. I mean, unlike a lot of people, I didn't have a real high fever, just a really low-grade sort of fever. So I wasn't certain that I even had this at the beginning, but finally went and got tested, and I got to the point where I was too sick to work, so I stayed at home, and this was fairly early on, so the tests were taking a long time to come back. So it actually took 2 weeks for my test to come back.
Wow. And by then you had already been home trying to figure out how to take care of yourself. So what were some of the remedies you tried? What was your routine?
Well, we basically, at that point, the Plaquenil remedy was still pretty popular. This is kind of before they had some controversial developments and Plaquenil became less popular. There was an article that came out that said Plaquenil initially was supported, and then an article that came out that said that it was too toxic and fell out of fad. But then some criticisms of that study came out. So officially now it's not considered real popular, but at that time it was considered a good treatment. So I went ahead and got it and wanted to start taking Plaquenil, and we had a hard time getting any because at that point you you had to have a documented positive test result in order to get a script for it.
Mm-hmm.
So,
was there a lot of rearranging you had to do in your? I know your schedule for a doctor definitely was on hold, but how was the reaction of your family when they found out?
well, we were kind of just sheltering in place, wearing masks, and everybody staying away from me as far as possible.
Mm-hmm.
And I had people telling me I should go to the hospital, but I didn't really want to go to the hospital. I figured that was just going to be worse over there. And so I kind of really wanted to treat this at home unless it got to the point where I was really critically ill.
Mm-hmm.
And I did lose quite a bit of weight. I lost my appetite,
Mm-hmm.
and just had some shortness of breath problems, that sort of thing.
Okay.
I stayed in bed a lot, and
Were fluids very important
I
during that
tried to stay
time?
hydrated. I drank a lot of Gatorade,
Mm-hmm.
and water, and
So did you feel an immediate difference, or how soon when you did get the medication and start taking
so I
it?
went through the whole entire course of medicine. I guess I took it for at least, I'm going to say at least 5 days or so,
Okay.
and then I also took Zithromax, which was another controversial thing, and.
Mm-hmm.
At first, it didn't make much difference. I think gradually, as time went on, I started to get a little bit better.
Mm-hmm. Did you feel like your thought process was compromised, or a lot of energy was gone?
Yeah, just a lot of energy. So it took a lot more effort to get out of bed and just do anything.
Mm-hmm.
Like 10 times as much energy to take a shower, and
Wow.
that kind of stuff.
Mm-hmm.
It was an exhausting kind of thing.
Yeah. And so being in a different position, now you're being given the care, and normally you're providing all of the care. What were some of the thoughts that went through your mind as you just lay trying to recover?
Well, I guess that hoping that I don't get sick that often usually, and hoping that this was going to be something that would be short lived and something
Mm-hmm.
we could get over with and get back as soon as possible. And finally, I started to get my strength back. When I was able to start, eating a little bit more. It seemed like that kind of helped a little bit, and
Mm-hmm.
eventually, I started to get a little bit stronger,
Yeah.
and
And so, as you continued to progress and started to regain some of your normal physical abilities, and then how soon did you return to work?
I guess about 2 weeks.
Hmm.
And once again, this was at the height of the pandemic, and there's a lot of fear and just
Yes.
even amongst the healthcare people,
Oh,
a lot of
yes.
fear. I had close friends who had been patients of mine for years, just
Mm-hmm.
going to the hospital and wound up dying from this, and
Mm-hmm.
so it was kind of a scary time.
Yeah.
People weren't thinking rationally.
Sure.
Um, you know, uh, and eventually things settled into a routine with it. Eventually I did get back, but at that point, we were doing a lot of virtual visits
Yes.
on telephone, computer. Because people were too scared to come out of their houses and
Mm-hmm.
were being instructed to stay at home.
Mm-hmm.
And
And there
we
was
had,
still so much unknown at that point as well, even at
the
the height of
hospital
it.
practice. That kind of that took a hit initially, but eventually it started picking back up again.
Hmm. What was your perspective when it came to the nursing home scenarios? Because that seemed to be such a tragic situation.
We were debating on how to handle that, whether we should try to make all the rounds by telephone, and eventually we just decided to gown up and garb up as best we could.
Hmm.
Gloves and gowns and masks, and 2 masks initially, and kind of go in and this whenever you enter, there's somebody taking your temperature, asking you questions before you can enter any kind of facility. And nursing homes are a hot spot. Obviously, you have a bunch of old sick patients in one area. If the disease gets in there, and this is a very contagious disease,
Hmm.
it can wreak havoc in a nursing home. You've heard stories of nursing homes with
Multiple.
10, 15 people dying in the
Yes.
nursing home. So
Yes.
um,
Yeah. Were there changes you made as you went in to give them care, isolating some people and as you found out maybe who?
Yeah, I mean, certain nursing homes, I can think of one in particular that had a wing
Mm,
that set off and it separated quite well. So they put all the COVID patients in that wing.
okay.
And they actually kept them there at the facility, which worked pretty well for that one facility. But most of the facilities that I'm at were afraid to keep the patients in. So they wanted to send them out as soon as they could.
Mm-hmm.
And it's an interesting disease, and some people tend to have a mild presentation, and other people get a real serious presentation. So um, even the mild presentations, if a person tests positive, would have to go, get out of the nursing home, usually
Right.
get into a hospital or something.
Mm-hmm.
Then they eventually open an intermediate COVID facility at the convention center, which is an off-hospital site. We could start sending the really mild cases there, when we
Mm-hmm.
had nowhere else we could put them. So
Mm-hmm. And for yourself, having gone just about the 2 week process, and thankfully never got to the stage where a ventilator was discussed, or you didn't have that type of challenge, and so that had to be very fortunate. Now, did you have to go through the testing again to test negative before you could officially return, like some people?
uh, actually, as I recall, I was kind of cleared to go back at some point about maybe 4 weeks afterward, and
Okay.
eventually took a test that came back negative, and I was okay to go back. And uh, but once again, at that time we weren't getting these tests back too quickly. There was a big lag time, and
Mm-hmm. Waiting on results.
waiting on results. And
Yeah.
I was, um,
How was your
when
family?
I did go back, I was mask on for everything. Just I try not to, just in case I was still contagious, try not to infect anybody else.
Mm-hmm.
But yeah, my family did fine.
Were they able to, or did they feel the need to be tested since everyone was in the
Yeah,
home?
my wife eventually got tested, and she had antibodies, so she'd been exposed to it, but she didn't really have
Oh,
any any significant
symptoms.
symptoms. I think
Okay.
when my son had a mild flu-like presentation. He's much younger, so
Mm.
so
So
for some
what?
reason I was the one that got it
Yeah,
really.
the carrier, right?
I was the one that was the worst hit out of
Mm.
everybody.
Yes. Well, post COVID-19 for yourself, how do you feel? What are your thoughts these days? Because everything is still happening and you're still having to care for others who've gone through this. Do you find that you have a better handle on information on how to help someone else maybe endure what they have
And
to?
right now in our city, we've had everybody shelter in place, the economy shut down basically, and eventually, finally, the case numbers kind of diminished, so everything started to reopen, and now there's been a kind of an unexpected surge in cases again. And
Mm-hmm.
even though it's summertime, when these respiratory viruses don't tend to do as well, but this is a very resilient virus.
Mm-hmm.
So so now things are kind of getting a little more tense once
Mm.
again. You
Yes.
know,
So, what type of advice do you give your patients or even people that you know? Because, yes, we do have this uptick sort of happening again, and we've sheltered in place, and that's gotten a little relaxed. What type of advice do you give, or would you suggest? Seems to be
well,
the
certainly
best.
people who are elderly, it seems to hit worse. It seems to be worse than people who are older. So if you're older, over 60 years of age, then you're at high risk to have a bad outcome. Anybody who's immunocompromised, who's diabetic, certainly anybody with underlying respiratory problems who smoke, those people are all at risk to have worse outcomes and wind up on a ventilator.
Hmm.
So,
Hmm.
and what's kind of interesting is you're better to stay off the ventilator because the people on the ventilator seem to have a worse outcome than people who can stay off the ventilator.
Mm. Is there a
So,
choice for that, or does it just depend on where they are in the severity of the disease?
it's an interesting disease from what I've read. People who get COVID tend to have excessive clotting problems. They develop a lot of pulmonary embolisms, and
Lots of unknowns. And
and just the ability to circulate oxygen and metabolize oxygen is compromised.
mhm.
So even if you're on a ventilator, getting the oxygen, if it's not being utilized correctly, that's one explanation why ventilator patients don't do particularly well with it. So.
Mhm. So,
Um,
as a person who is unaffected, not affected, or is not displaying any symptoms, what advice do you give them besides if they're not in the high risk area? Is the masking the best protection now that so many people are out and about?
I think the mask can give some protection. I don't think it's 100%, but and it's very uncomfortable to have to wear a mask, especially in the summertime here in New Orleans.
And a shield.
And but I mean,
Hmm.
but I think it probably does help reduce the transmission when people wear masks. So
Hmm.
technically, it's probably a good idea to
Hmm.
keep it on as much as possible if you're in public place.
And what's your thoughts on hand washing, since that was the first and most common advice that everybody's been given? Wash your hands.
Yeah, that certainly doesn't do any harm, and
Hmm.
that they say the virus can stay alive on different objects and stuff for hours. So if somebody else has touched a faucet or touched something and you touch the same issue, then you might have that's a way you can contract it and spread it. So
Hmm. Hmm.
that's certainly something to consider is frequent hand washing and
Hmm. Yeah.
wearing masks and those two
Hmm.
things.
So, do you feel your practice is taking on any changes since you've gone through it? Have you implemented anything that you're going to continue?
Yeah, we're starting to open back up a little bit. I mean, we still have the masks on right now. In our office, for the really old sick patients who are really afraid, we do a few telephone visits, but it's not as frequent as we were doing previously.
Hmm.
So, and people, I find that there's a lot more anxiety out there. People get stir crazy staying at home all the time. So,
Right.
and there's the economic stress of not being able to work.
Yes. And so mentally, how have you been overall? Because this, a lot of times, just sitting, not doing what you're used to doing, you have a lot more time on your hands to think about things. So, how was
Right.
your mental, stability through this?
I like to think I'm a pretty resilient person. We down here in New Orleans, we went through Katrina, which was a big,
Yeah.
a big situation, and we have other, storms and issues to deal with down here, and but this was certainly right up there at the top of the list, and then the whole country had to deal with it. Really, the whole world had to deal
Oh,
with it. So,
yeah.
and just to let us know that we kind of think that we're safe from these kind of viruses in this day and age with all the technology and the medical advances we have, but
Mm.
still something like this can flare up, and
Yes.
until we get a vaccine, really nobody's going to be 100% safe.
Yeah. Do you feel the technology has played a big difference in how all of the your medical care has been able to be managed? Because worldwide, everybody's really turned to that for lots of different reasons.
Well, I think just the supportive care that we have compared to they talked about the flu of 1918, which decimated the world at that time.
Yes.
I think if this particular virus had been in 1918, you would have seen some real decimation. It would have been a lot worse than what it is today because we have better medicine. And
Hmm.
I think because of that, and even with all of that, this is still a pretty lethal virus. It's killed a lot
Absolutely.
of people.
Finally, as we
And
close, what is your outlook and hope for New Orleans? This is where you live, and of course the world is a concern. But how do you see optimistically the future with what we're dealing with right now?
well, I think we're a resilient city, and I think things are going to eventually this will come to an end. I mean, we'll develop a vaccine. We'll reach a certain level of herd immunity,
Mhm.
and when all that happens, this will be something in history. We'll look back on this time and say, just like other flu epidemics where people were dying right and left, and we'll say, well, this was something we had to go through, and
Better for it?
yeah, I think so. I think we're going to be a little bit better for it. It's something that certainly nobody's experienced before,
Certainly.
and hopefully we won't go through it again in our lifetimes.
Well, we thank you for your time, for sharing your personal story and your professional story. And we're so glad to be able to say that you're a hero because you're on the front line in more than one way. And you have made a difference in continuing to provide care for everyone. And so we are really glad to be able to speak with you on the other side of this. And we definitely want you to have nothing but great and healthy days ahead. So, everyone, Dr. Michael Russo, and thank you so much for all that you contribute to our care.
Well, you're more than welcome, and it's been a pleasure talking with you today.